Here we are. We are now live. Hey, hi. Welcome, everybody. I'm super excited to have Teri Dreher with me today. She is amazing. She is an RN with over 35 years of experience in healthcare and is a pioneering in the emerging field of professional patient advocacy. And on top of all that, she is a well-known Amazon best-selling author and public speaker. And there's nothing more important today than patient advocacy. So I'm so glad you're with us. And Teri, tell me, I know you're doing some exciting things. So let's start out with you telling us about what you and your team are going to be presenting. I know you're having a conference that's coming up and something that anybody can get a ticket for and come in here. So welcome.
Well, thank you very much, Betsy. It's a true pleasure to be here today. We are having a conference June 16th in Glen Ellen at the Abington Distinctive Banquets. It's a very luxurious event site, and we are offering meals and free parking. And for less than $100, you can come and hear 6 hours of wonderful, wonderful, high quality material from speakers around the country that are going to help you as a common healthcare person navigating a complex system right now. They're going to teach you, we're all going to teach you how to do it more safely, because today in America, we've seen a lot of healthcare changes over the last 10 years, and a lot of people get lost, confused, frustrated, afraid. And that's one of the reasons why our field is growing so much. But this year, instead of presenting to professional patient advocates, I wanted to open it up and invite the general public and help them improve their own healthcare literacy. Most people can't really always find or afford a patient advocate, so I'm going to teach people how to advocate for themselves and their loved ones.
That is incredible and amazing, and I am going, and I hope many other people go, because it's the kind of thing, like, all of a sudden you're in it and then, oh my God, what do I do? And it's, if you think Comcast is complicated to get something on your television, or streaming is complicated, just jump into the medical field. It's impossible. Maybe you can share with us some of the topics that are going to be discussed.
Sure. Well, our very first keynote, I'm going to be interviewing Brad Schwartz. He's an attorney who was also a victim of medical error. He has a very impactful story. I mean, he's a highly intelligent person, comes from a very assertive family of attorneys, and people were with him in the hospital on a holiday about 19 years ago. And he, because he didn't have a medical advocate with him, he ended up losing 4 limbs, being on hemodialysis, being on respirator, and all kinds of life support. And here we are almost 20 years later. And Brad has a wonderful story, and it's very inspiring to me. And I'm going to play the the news anchor and interview him and just weed out some of those areas of gaps that he encountered that are so dangerous. See, Betsy, the thing is, people don't know what they don't know.
Absolutely.
And so when you encounter the healthcare system and you're told something very firmly, you want to believe the best in people. But because today's version of healthcare is so fragmented and siloed, and people don't have time to read all of the notes and the charts and everything, that's why you need somebody standing by your side, a family member or a professional patient advocate that can speak up, ask the right questions, say no when it's time to say no. And it can save lives, really. But I want to teach people in the general public how to do this so they can save their own lives and their families' lives and save tons of money. We're going to have somebody come and talk about Medicaid, how you plan well for Medicaid. We're going to have somebody come and talk about all the different levels of senior housing, what they are, how much they cost, how you pay for everything. We're going to have somebody come and talk about managing all those long-term care expenses. It's pricey out there, and not everybody can afford to have their own personal caregiver 24/7. So we're going to give people options for every different budget, and answer a lot of questions. And it's just going to be a wonderful, inspiring day. My goal is that everybody that walks out of this conference gains at least 3 or 4 things that they can use in critical times in their own families. And, we have no do-overs with our families, right? I would give anything to have my mother and father back with me again, but most people are really struggling right now. And so we want to give them some tools, some solutions. And we even have a medical malpractice attorney coming and talking to people about how whether or not you have a medical malpractice case, because it's getting harder and harder when harm is done to go ahead and seek damages.
I could not agree with you more. I am beyond excited that you are doing this, and I can't wait to attend myself
Thank you.
because, like I said, it is a maze of people have no idea when they go in there.
Mhm.
And I bet if you went in a room, we'd find every single person can say, I could have used that. I
Mhm.
wish I knew more.
Mhm.
Um, my mother was ill, and the three of us, all highly educated, everything, we had to band together and try and demand answers and figure
Mhm.
out what was going on. And it was not easy.
Right.
And and she was not ill for a very long time. So
Mhm.
if it had been a more complicated scenario, it would have been outrageous. So I cannot thank you enough for doing this, because Teri and I share that our goal is to get out to the community. We know as professionals how
Yeah.
complicated this is,
Yeah.
but we want to help the public so that they can improve their lives. And if people need details, if they want to attend the conference, how can they get that information?
Well, the website is www.northshorern.PAC. That's for Patient Advocate Conference. And so it'll take you straight to the page. You can see every single topic, every single speaker, every single bio. You can hear all the things that we're going to be talking about. And just Google too, just Chicago Patient Advocacy Conference.
Great. And I will put that out on my social as well as my
Thank you.
website. So it'll be everywhere that Betsy Phillips is. You can come and find the links to Teri on
Oh,
my
and
social.
Betsy, I almost forgot to say, we're having a 2-for-1 special for Memorial Day.
Ooh,
So right now, and even next week, we're going to have a 2-for-1 special because I want to help more people. I want women to bring their best friend or their husband or anybody that they want, and it's like buy one get one free. And it's already a great price. We have to pay for the venue, of course, and the food, and a lot of
and
expenses. But
that's right. People are flying in for the
yeah, they are.
speakers.
Mhm.
This is a great price and a great opportunity for
Mhm.
people to really spend a day, and you will be amazed at what you come out. I actually am like giddy about it because I can't wait to know more so that I can help more people.
Thank you.
So
I believe that too. And you never know. Very often I'll go speak at libraries, and then 2 or 3 years later, somebody will have saved my card, and they'll call me up and say, "Oh boy, my husband just had a fall. He's in the hospital. We're lost. They're trying to push him out." Just this week, I have a highly intelligent person. She has her PhD, and she went in for a fairly simple surgery, and she's having excruciating pain. And they're trying to tell her that she has to leave. And I said, "No, no, no. Pain control is a basic human right. It's a patient right. You cannot leave that place and go back to rehab until your pain is well managed." And so I've had to have some respectful but difficult conversations with the doctor's nurse practitioner, with the pain team, with the care manager. They cannot send my client home until her pain is well controlled, because where she's going, she's not going to have all the advantages of a hospital pharmacy and putting on a call light and getting somebody in there in a few minutes. So we're pushing back and saying, no, we understand what patient rights are, and we're going to stand up and say, you cannot do something that's going to cause harm, stress, or anxiety to my client.
That is wonderful. And I think that that's, if people don't know what a patient advocate is,
Mm-hmm.
it is it is standing up to authority in some ways, because let's face it, the hospitals are a business today, and they
Yeah,
want to get you in and out.
quickly.
And I'm sure there's metrics out there. They're looking at how many
Mm-hmm.
patients they bill and all that. No, we are here to protect the consumer and the individual.
Mm-hmm.
And for our younger audience out there, it's like your rights in school. If your child has special needs,
Yep.
you know, I was told, oh, they're fine. No, they're not fine. Okay. No, they are not fine. And as soon as I brought an expert in, all of a sudden they were not fine. And I received the services I need. But this is what we're talking about. And there are many, 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 many little loopholes and tricks. And if you are not,
Mm-hmm.
if you don't have health literacy, which Teri
Right.
talks about,
Mm-hmm. Yeah.
getting your book. If we get your book, read your book,
Yeah.
show us your book there.
Yeah.
That's going to help us additionally if we want to have some
Yeah.
resources.
Exactly. And we still have a few spots left for the free book offer too. So we said that if people sign up quickly, we're going to give a lot of the people, over half of the people, a free copy of this book. And this book is a compilation of a lot of my Daily Herald articles, the most popular ones. And people can take it home, read it, keep it, use it as a reference, a resource. And if they're not sure about something, they can just open up the book and say, look in the table of contents and find out what the topics are. Because a lot of times, because you picked up on a good point, Betsy, hospitals are businesses right now, and doctors and nurses in the hospital are being told by administration, okay, insurance isn't going to pay for them, get them out, get them out, get them out, otherwise the hospital has to eat about $6,000 a day. But I say, do the right thing and you're going to save money. So keep that patient there until her pain is well controlled and she's comfortable going to a lower level of care, because she's a human being. She's not just
A
something on a
number in a bed.
yeah. That's the way it does seem right now, and I've been a patient lately too, and I see that, and my heart goes out to people that work in hospitals, but I'm still outraged when I see rudeness and telling people things that are just blatantly not true. People need to learn how to nicely advocate for themselves and their loved ones, fill the gap. When I say advocate, I say we fill the gaps in modern healthcare, and everybody that goes through healthcare right now knows that there are a lot of gaps, dangerous gaps in modern healthcare.
Absolutely. And, we don't want to be negative, but
No,
absolutely. I mean, they can't even hire people because they don't have the people to hire the people to hire the people.
right.
So, it's ridiculous. So, what you are doing, Teri, is just amazing. There's just a few other things I wanted to touch on. Are you doing something special for lower income families? You want to touch on that? I mean,
Well, not everybody can afford to hire a patient advocate to help answer those dozens or hundreds of questions that are out there. So if they can't, I think just having a 30-minute free consultation is fine. I do those every week. My Daily Herald readers come and they call me directly and they'll ask me some questions. And a lot of times I can just point them in the right direction and give them 2 or 3 really excellent resources. But if they do have something really big and scary and dangerous going on, then I can teach people how to cobble together the money to pay for a limited number of hours for a patient advocate. Most people, I mean, we're not as expensive as attorneys, but
Mhm.
what we do is life-saving, and, um, and it's really important to get your medical affairs in order and to hire somebody because older people especially, grew up in the age of Marcus Welby. And you never questioned Dr. Welby. And Dr. Welby knew all of your medications and allergies off the top of his head. And he didn't have to go through looking through everything. But healthcare isn't like that anymore. It's very fast paced. There are a lot of communication errors and gaps. And that's the number one cause of medical error. Things get missed. I even had a son who had to go in for surgery and we told him that he was allergic to Dilaudid, which is a very powerful pain medication, and they gave him Dilaudid, and he called me at 3 in the morning and said, "Ma, you have to get here and look at my hands. The skin is peeling off my hands." And it was all over the chart that he's allergic to Dilaudid, and the night nurse called the doctor and got an order for Dilaudid because he was in so much pain. So, there's not a lot of common sense, but sometimes it's not even common sense. It's following the algorithms and, following what your higher ups tell you to do so that you can keep your job. People are afraid of speaking up in the hospital today.
Yes, yes,
Mhm.
yes, yes. And just real briefly, when my mother was in the hospital, it was a lag in what the doctor said, and then the information getting into the system, so the
Right.
nurse knew what to do.
Yeah.
Okay, if that takes 3 hours, and the doctor says this person needs this, and the nurse says it's not in their chart, I can't do it because it's lost in the cyber. People don't believe me when I tell them that this is what happened. This is literally what happened.
Yeah.
And
Mhm.
that's not okay, you know?
No,
So
no.
anyway, um, eh, this is so important. Again, I want to thank you, Teri. I am going
Mhm.
to put all your info on social so that people can sign up,
Thank
come to the conference, and I hope to see many people there as well. I'm
oh,
really looking
thank
forward
you.
to it.
I'll send you a flyer that you can blast out too, Betsy, because
Thank
I'm
you.
I'm just really passionate about patient safety. We're making this whole thing as attractive and inexpensive as possible because we know that people need to be more empowered going through the healthcare
Absolutely,
system.
absolutely. I can't wait. I'm very excited,
Okay.
and you're gonna be people are gonna be blasted. So between now and when June, they're gonna be blasted
Thank
because
you.
thank you so much.
Thank
Everybody have a
you.
wonderful, safe Memorial Day weekend
Okay.
and
Thank you.
enjoy the weather's supposed to be getting warmer every day. So be safe.
Wonderful. Thank you so much,
Thank
Betsy.
you so much.
Okay.
Bye
Bye-bye.
now.